Time to take a coding break. Welcome back to another episode and the final 2025 episode of the Coding Break podcast. I am your coding coach as well as your coding instructor, Tam Talk, here to talk about all things medical coding related, the good, the bad, as well as the ugly. So, what should we talk about in our final episode of 2025? I know many of you are making your goals, like whether it's like want to find a coding role, whether to get promoted in 2026 with your medical coding certification, or maybe pivot altogether out of medical coding. And all of that is fine. So one of the things I want to talk about is pivoting. I know, like, if you follow me on TikTok, you follow me on some of the social apps, I always talk about learning to pivot and taking a coding break. Most definitely, we must take a coding break. But I never really discussed how you should pivot, right? And so one of the things I want to is kind of pivot from, like, just teaching you the basics of medical coding, because I do have a course on that. And so I don't want to continue to reiterate what's in the course. So I wanted to just talk about some of those, I would say, soft skills, soft issues that we need to focus on. What are some of the things that is hindering you from getting a coding role? What is some of the things that are hindering you from getting promoted? What are some of the things that you are doing, or perhaps you're not doing, that's keeping you from moving to the next level in your coding career? So aside from, like, okay, there are so many people, it's like a lot of people becoming coders, and everyone is going for the same jobs or what have you, or they're not letting others in for the roles. These are things, I mean, they do happen, but I don't think it's like that is a end all be all of the reason why medical coders can't get a coding role. Some of it could be that perhaps you're getting you're becoming a coder because you're trying to stabilize your income, and I'm not knocking that. Another one could be that you that's not your calling, right? Actually, it kind of ties into what I just said. So, for example, medical coding may not be your actual calling or your purpose. And again, you're doing it because you're looking for a quick income, or you're thinking you're going to get quick income. But medical coding is a career. I mean, it doesn't have the same relevance or admiration as that of a doctor, or let's say a lawyer, or something more prominent. But it is prominent because in order for doctors to get paid, their services need to go through billing as well as medical coding, and then go to the insurance carriers, right? So yes, so it is very important. It's very intricate. It's a very intricate part of, I guess you say, healthcare. So, what are some of the things that you can do, or what's some of the things questions you can ask yourself as it relates to pivoting in the medical coding industry? For example, like you want to, let's say you want to get a role, right? So I know that a lot of things have changed on the front of, I'm going to say, like interviewing and just looking for a job, because we have technology that has infiltrated the workspace. So AI, so a lot of these things are being done or tasks are being performed by artificial intelligence. But that's why it's important to have the human connection, right? So that, because here's the thing, humans can get emotions, they can get a better understanding or a deeper understanding of an individual. So one of the things that I would say focus on in 2026 is your soft skills, right? Yes, you may have completed the course, and you may have successfully passed the coding examination, and that's great, and that's one way to get your foot in the door. But we need to focus on our soft skills. What a leader is looking for, or a coding leader is looking for, and again, I'm not speaking for all, but I would say some things that they are looking for is ambition, like your willingness. What are you bringing to the team or the organization? What what assets are you bringing to the coding team or to the organization? Like, are you going to enhance the team? A prime example of that may be, I'm going to say, artificial intelligence. Do you have some sort of artificial intelligence background or training? Are you willing to learn? Are you willing to pivot as the organization or the coding team evolves, right? So so if you are a structured person and you rebel against change, because here's the thing, medical coding is an ever evolving or ever changing industry. Each year the codes are changed. They may be deleted, may be updated, maybe new codes, the guidelines, the rules, how you code may change, or they will change each year. So are you accustomed to just structure? You hate change? Okay, coding may not be your role. Or I would say like day-to-day coding may not be your role. Are you a researcher? Do you like researching? Yes, because there includes a lot of research in the medical coding industry. And yes, we have AI there to kind of help with the research, but still you may want to do your own dumpster diving, right? Or deep dive of research as it relates to medical coding or the healthcare industry. And so, I'm going back and forth, like soft skills and then some of the things that you want to bring to the table. So we talked about being flexible, having that flexibility to change. If you don't like change or you're very structured, then this may be something you want to take a look at. Another thing too, time management skills. Whether that is on-site or remote coding, do you have time management skills? Do you have the discipline to manage your time effectively without or with little supervision, especially in the remote setting? Are you able to manage your time? Are you able to complete the tasks that are presented to you with little to no supervision? If so, then yes. If not, again, you may want to ask yourself if medical coding, especially remote coding, if this is something that that may be aligned with your purpose. Okay. Another thing is, let's see here. Okay, we talked about like time management. We talked about structure. So let's talk about, well, you are certified, so that's out of there. How do you connect with other people? Teamwork. How do you connect with people? Even when you're remote, how do you connect with other individuals on the team? So it's very important. For example, this is something that has been a long-standing joke or long-standing comment. Like if you put 3 or more, or I would say even 2 coders in the same room, and you present them with the same scenario, I guarantee you, matter of fact, I can promise you that you're going to have different strategies on how to come up with a code. You may even have a different code, right? How would you react if another coder had a different strategy or a different result than yours? Would you argue with that individual? Would you agree to disagree? Or will you stand 10 toes down? Or will you present a reputable, factual resource to confirm your strategy or your diagnosis or whatever your code be, diagnosis, procedural? What is that? Like, how would you respond to that? Okay. So these are some of the things that you have to take in consideration. Yes, I know, like on TikTok and on all of the other social platforms, we may make it appear to be easy. And again, I know I do. Like, yes, if you can read, you can code. Yes, you can code, but can you get a coding role? So yes. But again, in my previous one of my previous episodes, I talked about, like, you don't have to do day-to-day coding. You can work in other forms in other industries with your medical coding certification. It just has to align with the purpose and what your strengths are. And like we all have strengths as well as weaknesses. Again, if you're looking for day-to-day coding, these are some of the things you have to take in consideration. Whether you are flexible or I'm sorry, I'm saying it here. If you're flexible, are you able to research? Are you able to get along with your teammates? Again, this is whether you're on site or remote. So these are some of the things that take into consideration. For example, like teamwork, not just your coding colleague, but let's say your supervisors, your managers, directors. Do you have that? Are you able to get along with them? Right now, keep in mind, like I've seen things on TikTok where like some of the managers and managers, supervisors they dislike their employees. I don't think from someone put like this from someone who has actually worked in a leadership role. There are levels to these things. A leader or a manager, they don't dislike you, because if they dislike you, you wouldn't be hired, right? They have orders as well. So just like they I don't say bark orders to you, they provide rules for you that you must adhere to. Those rules are coming from above them. So they are, again, trying to, I would say, incorporate the rules. Also, they try to look at it from your side as an employee, as well as the other side as the employer. They try to create a happy meeting point, so that the coders are happy, which are those who are actually doing the coding, and then the employees are happy. So yes, so the leadership or middle leadership, they are in, I guess you call the sandwich. They're in the middle because they're trying to appease their directors or leaders as well as their employees. So yes, so again, are you able to have that perspective, that mindset that they're not just doing it because because they're picking on you, but they are, again, trying to create or relate tasks or orders or rules that was presented to them by their superior. So yes, so they're trying to find that happy median for both the employer and the employee. So if your mindset is, again, that the manager doesn't like you, they're making it hard for you, again, trust me, a lot of these rules that you have to adhere to that are relayed to you by your manager, these are rules set out by the employer, their leader. So those are things you have to take into consideration. So with saying all of that, is your mindset. Where's your mindset? Do you have a different mindset? Is your mindset, I won't say open, do you have a different perspective? Again, all of these things are taken into consideration when you are applying for a role, a coding role, or just any role in general. Like, do you have a flexibility? Do you have the skills? Yes, we know you have the skills because you passed the certification exam. Some may say, do you have experience? Now, I do know there are some employers who are becoming a little bit more lax in providing opportunities for new coders to come in and gain their experience, so that they can, like, if they choose to stay with that organization, or they decide to pivot elsewhere, they will have the experience that we once had. So yes, so these are things that we have to take in consideration. And then also, like I said, the mindset, the flexibility, time management skills, and just like, again, the perspective. So these are some of the things that you have to keep in mind when you're applying for certain roles. Although the roles or the description of the roles that you're applying for, they're not explicit as to like giving all of the details of what's required. You have to keep those in mind when you are looking or applying for roles. Do you have the mindset? Do you have teamwork? Do you have the skills, the skill set? Do you have the flexibility? Again, because medical coding is ever evolving. It will forever be evolving as we progress, especially as technology has entered the chat the chat or the group chat. So so keep in mind when you're applying for these roles, ask yourself these questions. Do I have these particular traits when applying for a role? If I do, yes. If I don't, I'm not saying you shouldn't apply. Perhaps if you get the interview, and if the interviewer asks if you have questions, this would be your opportunity to ask those questions. Like, exactly what are you, to ask exactly what they're looking for, right? And so, so again, when you're applying for a coding role, these are some of the things you want to take into consideration. And if there's things that you don't hold or you feel like you can work on, like the flexibility, the time management, then you may want to work on those weaknesses and come back. Sometimes some employers will allow you to work on those things in the role. However, I will say this, let me pick it back. Time management is very, very important in medical coding. And the reason why I stress the time management skill, because there are productivity goals that goes along with medical coding. Productivity goals are time-based, right? So, for example, how many coding incidents have you coded throughout the 8 hours of the day, or however many hours you work for that day? It is very, very important that that you have time management skills, right? That you have time management skills, that you're able to track your time management, your productivity. Because again, those are things that are often looked at, especially in like your reviews, as well as your coding audits. And that they're not just looking to see if your coding is pristine. They're also looking at how long it took you to code. So so it's not one or the other. It's a combination of both. So that's why I stress the importance of time management skills. So so that's all that I have for today, because I can go on and on about that. But I'll probably drop it in another episode in 2026. So again, this is our last episode of 2025. So so I hope to see you on the other side. And as always, remember to code on. And again, I would like to wish all of my Coder Pros a happy new year. And I hope to see you on the other side. Take care.